just over a minute from getting started. We have a lightning chat with which will be a fascinating case study of electronic immunization registries in Viet Nam. We'll be talking to Dr. Nga Nguyen, the country director for PATH's Viet Nam office. Very much looking forward to this conversation. Welcome to join us this morning in Geneva, afternoon, evening, whatever it may be for you. See you in a few seconds. Warm welcome from the Geneva Learning Foundation. I'm Rida Sadki, ahead of the PAHO course on electronic immunization registries from planning to implementation. We're very pleased to be meeting and to have as our guest Dr. Nga Nguyen. She's the country director for the PATH's for PATH's Viet Nam office, and she's going to share a fascinating story about electronic immunization registries, a case study about her work, her involvement to support the Ministry of Health's efforts to establish electronic immunization registries in Vietnam. Welcome, Dr. Nga Nguyen. How are you doing?
Thank you. I'm fine. Thanks. Thank you for giving me this opportunity to share lessons learned for EIR initiative in Vietnam. Thank you.
Thank you very much for joining us. Could you tell us, introduce yourself, tell us a little bit more about who you are and what you do beyond the title and country affiliation?
So I am Dr. Nga Nguyen. I am medical doctor and also PATH Viet Nam country director. I have been working for PATH for 11 years. And during 11 years, I have been leading EIR work in Vietnam for almost 10 years, together with other work for mostly for vaccine immunization and also for infectious disease control for NCD and TB, HIV, and many other programs at PATH. For those who may not know, PATH is a global organization and we work to accelerate health equity by bringing together public, business, social enterprise, and investors to solve the world's most pressing health challenge. And with expertise in science, health, economic technology, advocacy, and other specialties, we develop and scale solutions, including vaccine, drug, device, diagnostic, and innovative approach to strengthening health system worldwide. And digital health solution is one of our most core strength and innovative approach to solve this problem.
Thank you. And could you give us a sort of big picture sense of your role in establishing your country's EIR? What was specifically, what have you been doing, and how would you overall describe what you've been able to contribute?
So my first job at PATH was a project manager for Optimize project. At that time, I was managing a project and an initiative to develop and pilot EIR with very small scale, started 10 years ago in Vietnam. At that time, we have working very closely with national EPI to identify the problem with their information system about the reporting system and then that they need to change the system. And we together with national EPI to design the EIR. At that time, we called immunization registry system. And also, beside that, we also developed another health information system for vaccine tracking. So we piloted in the very small scale in one pilot, in one district only in 2011. And then we going to the bigger scale as a nine districts in one province in 2013. And then in 2017, we're going to nationwide application with more than 700 districts in Vietnam. So now our EIR have been used by all of more than 11,000 common health centers in Vietnam. So our team at PATH have been helping Ministry of Health and National EPI to develop, design, and pilot and scale up EIR. So now that we're helping them for transitioning to paperless system and also documenting the lesson learned for sharing globally. So our EIR work had been supported by different donors during last 10 years, including Gates Foundation, UN Foundation, and GSK. So also this work already had been awarded the Healthcare Innovation Award by GSK in 2015. So I had been leading the team go to the different stages of EIR, like designing, planning, implementation, and evaluation for almost 10 years.
Great. So we're speaking with the country director of PATH's Viet Nam office. This is Dr. Nga Nguyen, ahead of the course on EIR offered by the Pan American Health Organization. So, Dr. Nguyen, could you tell us, now we're going to dive into the case study, and really would like to ask you to think of a time when you solved a problem or had a breakthrough. But perhaps you first want to tell us about the series of challenges that you faced before we zero in on one specifically for the case study.
Yes, so actually during the last 10 years with different states of EIR, we have been facing many different challenges in the different time, including like a limited human resource with frequent staff already overburdened with multiple jobs at the same time. And at lowest level, the health staff mostly have a limited IT knowledge, and some of them hesitant to change to digital system. And a lot of delay implementation due to the high burden of using the dual system, both paper-based and digital system at the beginning. And we have a very low uptake of private sector for using system. A lot of issue with data use and data quality. In some remote area, very limited IT infrastructure, electricity, also internet, and limited state budget for training, refreshing, and supportive supervision. And at the time we started the EIR, there was no global and national standard about interoperability, architectural framework, and also policy guidance in place. No clear roadmap, costing plan from government for implementation and scale up. So, but the most challenging time could come from the beginning of this initiative 10 years ago, when we first introduced or piloted EIR in very small scale.
Right, so this is in 2010, 2011.
Yes.
Can you tell us what happened? What was the challenge there, and what did you do about it? Who helped you? What? Yeah, we really want to hear this story.
Yeah, so about 10 years ago, first when we had a very small scale, one district with 17 communes in very short time, in several months, we did not realize how much work would be when we become a bigger scale in the 9 districts for the whole province with 164 communes. So after introducing EIR for almost 3 months at that time, I thought we provided a lot of training for health workers at on level. But during supportive supervision visit, we visited commune health center. We realized that not many health workers use the system due to many reasons. So they got a training, they did not know how to use this system because at that time computer is very rare. So even they didn't know how to use computer. And staff who were trained already moved to another job. And they reluctant because they have got high burden. They had to enter this data for the cohort who were born for last 2 years until date. And some aging health workers very hesitant to change to digital system because they feel very comfortable with paper-based system for almost 20 years. So a lot of data quality issue even with the paper-based system. So then they enter the data for the system could not work as effectively as expected because data is not good. So at that time, health workers really getting tired of new system and they wanted to give up. They did not want to use it. So we had to discuss together with local health leader and also staff at the lowest level to identify the problem and discuss together to find the solution. So firstly that we focus on the strengthening commitment from health leader because it's very important. And we finding the champion among end user. and advocating and for behavior change communication for the health setup, for the important digital health system to improve quality and also effectiveness of immunization program. So we have our leader to organize the monthly and quarterly review meeting with the common health worker. So then we attended and were able to listen to their problem with using system, why they did not want to use the system. And we provided support and we did a lot of corrective action and also did a lot of behavior change communication at that time. So we also use the meeting for recognition and give an award for super end user, get them motivated and spread that spirit to other end user. And we developed a lot of SOP to help health workers to improve data quality, how to check and also ensure the data consistency between the paper-based and digital system, and review capacity and change the supervisor at provincial and district level, especially very important at the district level. So then they were able to provide the on-site support during the supervision visit. Even we developed some the checklist tool to help supervisor to check the data quality. And we have also provincial district level to conduct frequent and targeted supervision visits. So we focus more on the common health center with low capacity and low system uptake, increase frequency the visit at the beginning and reduce frequency later when it's so. So a lot of solutions have been done at that time to solve this problem.
Thank you for this, again, extremely concise and to the point summary. It sounds like a lot happened. Can you give us a sense of the time frame? You said you started in 2010, 2011. How long before you got to the point where you had solved most, if not all, these problems, had implemented effective forms of supportive supervision? How long did that take? And how, before we talk about how it turned out.
So after 6 months of intensive intervention, I can say that at that time we do it very intensively. So on 164 communes have entered data to the system, and health worker was able to use system to register newborn and plan for immunization section. They can order the vaccine by using system, and they capture immunization data and generate immunization report. So at the end, that health worker was very happy with system.
That was going to be my question to you. Was there a tipping point where you saw individuals that you interacted with going from tipping over from being skeptics, being reluctant to use the system, seeing it as something that made their lives more complicated, to the realization that this could have significant benefits and make their lives easier? Can you tell us about that moment?
Yeah, so actually at that time that we through the supervision and the review meeting, we did interview a lot of health workers, especially the one that hesitant before to use the system. So we found out that their acceptance is very high. So they're so happy with system, and even the aging health worker who never used computer before, they found system very helpful, and they would never want to go back to paper-based as before system introduced. And also that we did the final evaluation in 2015 after 1 year of implementation in the one province. So the results show that the EIR have helped to reduce significantly the time burden for health workers for planning and reporting, and their acceptance very high. And especially more importantly, the timely vaccination of several vaccines like a pentavalent and measles first dose was significantly increased, about 20% up. And the dropout rate also reduced significantly compared with before intervention. I think that is very big achievement that EIR bring to the health worker at that time.
Indeed, Dr. Nga Nguyen, you are the country director of the PATH Viet Nam office. We've been talking about electronic immunization registries in the country of Viet Nam. I have two final questions for you. One, throughout this process, what surprised you the most? What was the biggest surprise in terms of how it went, how it turned out? And second, what would be the most important piece of advice that you would share with a colleague from another country who is facing the same or similar set of challenges?
I think that the biggest surprise for us at that time, because when, like I said, that after implemented 3 months, we found very frustrated because the reluctance from the health worker, and they refused to use the system, and even we thought that we would like to quit at that time. But by the end, what we found out make us so happy, because the system acceptance and uptake, and the happiness from the health worker who using system. So we got a lot of lessons learned about how to solve the problem challenging at that time. So I think that government buy-in and commitment are very important to ensure the success as key number one key important thing, and still important until now. And additionally, change management process with advocacy and behavior change communication for health worker also important. And finding the champion among end user could be helpful also for advocacy work, and building capacity for supervisor at mid-level who will provide regular on-site support for lowest level to ensure sustainability. And data use and data quality also critical, should be paid attention. And frequent review meeting and supervision very helpful to early identification of problem and solve problem. I also recommended that we should utilize social media connect end user for experience learning and sharing. It's not happened at the time we piloted 10 years ago, but now we create the group chat to the social media network, and we connect with end user, and we provide frequent technical support timely and efficiently for triple sorting and solving the problem during implementation now. So we also take advantage of some application like a team viewer or Chrome remote desktop to provide technical support from distance. And especially during the COVID-19 time, we also develop and use a virtual supportive supervision platform to provide regular support for common health worker in remote area. Even without COVID-19 time, it's very helpful for common health worker in remote area. They can receive frequent support. And we also developing the e-learning program. It's very important for system yield, for data quality, data use. So health worker, they can get refreshing anytime at their most convenient time regularly. And even now, the transition process may be still a long way with a lot of challenge in Viet Nam. We believe that paper-based system will be entirely retired soon in Viet Nam on common health center.
Great. Yes. So many, in fact, many challenges and also many lessons learned. Thank you for sharing your case study, your testimony. Is also obviously significant engagement over many years to help progress the immunization program. Thank you, and look forward to seeing you in the course that will be, for which we are recording this case study. We have received many comments and questions on Facebook Live. We're not going to answer them today, but we will be answering them in the context of the course. Thank you so much once again, and look forward to further case studies. There's several others scheduled in the next 24 hours.